Good morning. It's a pleasure to be here. And I want to talk about something, we're going to talk about something I think is absolutely important, understanding the benefits and risks of vaccines as we use them for ourselves and as for our children or families. And by no means did I want this title to sound confrontational, because there has been a lot of confrontation in our society about the benefits and risks. So really what I want to emphasize is give you some information about the infectious diseases that we really are concerned about preventing here in the United States, not in some far-flung part of the world, but the risks that all of us face due to contagious diseases. This is a partial list of all the vaccines that are available, but the list that you see up there is a list of bacterial and viral diseases for which we have vaccines that are commonly used in the United States. It could take hours to go through each one of these. I'm not going to do that. I'm going to emphasize three that have been talked about a lot in the last decade or so, three that you've heard about a great deal, and talk about what the diseases are themselves and a little bit about the vaccines, perhaps as the basis for additional discussion in the breakout session. Now, I want to start, though, by just emphasizing what we're doing when we use a vaccine by going all the way back to the beginning. The first disease actually eliminated from circulation in the world by a vaccine is also is also the condition that brought us to this concept of vaccination, smallpox. So smallpox has been known since antiquity. It is an infectious disease caused by a virus called variola. And once infected, just before the blisters begin to appear on the skin, it's a very painful condition where the pain is diffuse. It's everywhere. High fever was common. Then you get the emergence all at once of bumps, these so-called pox, all across the body. This is a historical picture from the Center for Disease Control. And this was a terrible disease. About a third of people died in general. In some outbreaks, the rate was more like 50 to 70%. And back in the 17th century, it was recognized that transferring some of the liquid material from these pox to another person could provide some protection. It also was associated in some cases with disease, however, and even though, for example, Abigail Adams, in her letters to John Adams when he was in France negotiating on behalf of the colonies during the Revolutionary War, even though she realized that her family had been spared from an outbreak in Boston by doing this, there were certainly risks with using variolation, as this came to be known. The next phase, then, was the recognition that a related condition, cowpox, being exposed to that seemed to protect milkmaids from getting infected with variola virus in the middle of smallpox outbreaks. In other words, one virus seemed to give protection to the other. And so the hypothesis then was infection with one agent could protect against another. A mild disease or a mild challenge to the body could protect it from the more severe challenge of the real disease. And this was tested by Jenner, by the British physician Edward Jenner, and found to work. And the word vaccinia comes from, means of the cow, and it is this general term, vaccination, that emerged from this experience. Vaccination ultimately led to the eradication of smallpox in the last century. Last case recorded in 1977, and this vaccine is no longer routinely used. It's still available. It's used to protect against some similar sorts of viruses, but this disease simply doesn't exist anymore, and so we've taken it completely out of our vaccine schedule. Now, move ahead to a condition. Let's move ahead to a condition a lot of you actually have some knowledge of by virtue of knowing people who have had polio. I know most of what I know about the actual experience of polio, I learned from people my age or slightly older, not necessarily from this country. But a woman that goes to my church described her experience in the 1950s when, despite vaccination, she managed to get polio while taking care of her child who had polio in the middle of an outbreak, about 55 to 56, right as immunization was beginning. She ultimately was one of those people who ended up spending almost a year in an iron lung, as you see depicted in the lower left panel up here. The most famous person, of course, I think in American history having had polio is Franklin Delano Roosevelt. And what you notice on these pictures is how skinny his legs are, the muscle atrophy caused by the paralysis from damage to the spinal cord from the polio virus infection. And this is a very characteristic appearance. You'll find it on, you'll see images of people with withered muscles in Egyptian steels, and which is a stone carving. Here's a picture on the lower right-hand corner of an individual from 1991 in Vietnam who had polio, and polio does continue to exist throughout the world, and cases continue to occur, but fewer and fewer each year. Imagine then the excitement when Jonas Salk and then later on the Sabin vaccine produced by Albert Sabin came out, where people were electrified by the possibility of a world without having to worry about their children having polio. And a massive campaign, of course, got people out to get vaccines. I thought about putting some of these pictures of the time, showing people lined up for blocks to get injections of Salk vaccine, and later on, the availability of sugar cube oral vaccine from Sabin. These vaccines continue to be a part of our routine schedule, but not because there's a lot of polio around. After elimination of circulation of polio occurred in the industrialized countries, and it seemed possible to eradicate polio from the world, private organizations like Rotary International, working with international health bodies, pushed forward towards eradication, beginning with this program in 1988. In 1988, there were 350,000 cases of polio spread over most of the countries in the world, and we are getting extremely close to the possibility of eradicating polio. So far, this year, only 3 countries have had cases of polio, and those are Nigeria, Afghanistan, and Pakistan. We're quite close to seeing elimination, and the goal, the hope, is that in the next 5 to 10 years that will become reality. That will only happen, unfortunately, if we keep investing the resources in using the vaccines. Here's some information from the World Health Organization that emphasizes this. And the key points that they raise, the ones that I highlighted, is that polio continues to paralyze children, that unlike most diseases, like tetanus, for example, which is caused by a soil bacterium, polio is a virus that has no animal hosts. It's passed from person to person, and therefore it is possible, like smallpox before, to eradicate it with sufficient immunization. Every child, unfortunately, is susceptible to polio, and therefore every child deserves and needs the protection of polio vaccine in order to be protected from it until we actually see this complete cessation of the circulation of the virus itself. Now, in the United States, we continue to immunize for this, even though there have been no cases arising in the United States itself in quite some time. We don't use the oral polio virus vaccine anymore because you'll find a rare individual who has an abnormal immune system, and you find that out in infancy because they can be paralyzed by the polio vaccine itself. That's 1 in a million compared to approximately 1 in 100 cases of polio infection leading to paralysis. So it's important to keep that in mind, that like any medicine, anything you put into your body, sure there is some risk, but the 1 in a million risk compared to the 1 in 100 risk of total paralysis of lower extremities or paralysis of all limbs is what we faced. When it got to the point where the virus was not circulating, we switched to the injectable vaccine in this country. We continue to use the oral polio vaccine throughout the world and will until we reach that point where now that we've reached the tipping point where the added protection from oral polio vaccine is no longer needed, and where we'll switch to injectable vaccine in those countries like we do in the U.S. to finish up protecting children for enough years that finally, we hope, it'll no longer be necessary to use this vaccine. So the concept then is exposing the body to a challenge that is mild allows you to be protected against the real disease, the actual infection. That leads us then to something that we've heard a lot about in the news, which is measles. Measles is a virus that's readily transmitted from person to person, 99% transmissibility within families. Measles is not very common in the United States anymore, and so a lot of people have forgotten just how bad a disease this is. Some people have never seen it. I went yesterday to our Grand Rounds presentation at UCLA and talked with several of our physicians in training who had to admit they've seen many rare diseases, but they still have not seen a case of measles in the United States. So it's important for us to realize just how dangerous a disease this is. It typically appears as fever, followed by a cough, followed by runny nose and some eye irritation, and after several days, the rash. The rash that initially is red spots beginning on the face and upper body and then spreading outwards, and finally sort of blending in, all the spots blending in so that you get large open areas. Here's the rash that you see, the pictures you see here are typical appearance of measles on the trunk, and also the sad-looking face of a child who feels bad, but has the eye injection, has the eye inflammation along with the runny nose. And if there was audio associated with this, you have a pretty good chance of hearing cough because infection of the lungs is quite common, 1 person in 5. Hospitalizations, which are about 1 in 20, or I should say 20%, 1 in 5, are typically due to the pneumonia that can occur with measles. However, it's also possible to have brain infection. About 1 in 1,000 children will have encephalitis with measles. It can produce deafness, it can produce seizures, it can produce brain damage that has been linked to what we now refer to as autism spectrum disorder. So the bottom line here is that measles is not a benign child illness at all, and I think that's unfortunately one of the things that's gotten lost in our recent discussion. This is a disease in which 20% of people end up being hospitalized and about 1 in 500 children die. And that's not talking about ancient history. Back in 1989, we had an outbreak that lasted about 18 months here in California. We had 16,400 cases. Again, about 20% in that outbreak, 2 were hospitalized, and there were 75 deaths. 75 deaths. This isn't make-believe. This is children dying because either because of brain infection or because of lung infection. Moreover, as you may have heard in the news this week, we've continued to try and understand why measles makes you susceptible to other infections for months, for weeks to months. At least 2 or 3 months after measles, the body is also susceptible to other viral and bacterial infections. So you can imagine then why there was so much alarm about the outbreak of measles that occurred starting in December of 2014 with apparently initial exposure to individuals at Disneyland. In this case, public health authorities jumped on this like crazy to try and make sure that those who weren't immunized got at least a first dose, and those who had received an initial first dose got what is now recommended, a second dose of measles vaccine. We only got to 136 cases in this outbreak, and again, about 20% of those were hospitalized. It was 20 of 136, which actually is 14%. But that part was the expected part, that you'd get children children and adults who would have pneumonia. And the fear, of course, is if this ramped up rapidly, and you usually get 15 cases of measles for every case you see, that we would end up with thousands of cases again and begin to see the expected number of deaths. Fortunately, that did not happen because I think our public health system here in the state of California has to be credited with helping look for contacts and make sure that people had the protection afforded by the vaccine. Now, when we talk about measles, we usually end up talking about measles, mumps, rubella. So I threw in 2 quick slides about mumps, because mumps sounds like a much more benign disease, but it has its own problems associated with it. Well, what is mumps? Mumps is a viral infection, usually acquired by exposure to droplets from another person that has it, just from their coughing and the slight projections of droplet water out of the mouth. And the infection ends up settling into the lymph glands in the mouth and throat and in the salivary glands, and it's the swelling of salivary glands that you see in the picture and that is characteristic of mumps. But that is just scratching the surface, because many other organs in the body end up being involved. Mumps is, in countries that have not used the mumps vaccine, is the most common cause of viral encephalitis. Mumps has been associated with deafness. Mumps, as probably a lot of you know, also involves organs like the pancreas. About 1/3 of males between the age of 10 and 50 will have abdominal pain due to and testicular pain because of involvement of the testes, and girls and women can have involvement of the ovaries as well, producing abdominal pain. So again, not a benign disease, but one that we don't see very much because of the effectiveness of the mumps vaccine brought out in 1967 as a single vaccine and subsequently linked as part of the MMR vaccine. We continue to get clusters, however, typically on college campuses in the last 10 years or so. In 2010, we had 2,612 cases. And again, with this, there is the risk of encephalitis and hearing loss and brain injury, although mostly what you see is just the suffering attendant with the disease getting into various organs. So the way we prevent this now is using the measles, mumps, rubella vaccines. The two doses are recommended. They can be given as little as 1 month apart, but our typical schedule for children is to give them at about 1 year of age and then again at 4 years of age. And it does produce a mild illness that is very short-lived. 5 to 15% of children are going to get a low-grade fever. You do see rash in about 5% of individuals that get the vaccine, typically at their first dose of vaccine, typically a week to 10 days later, and in large lymph nodes in 5%. There are a wide variety of other minor side effects that we could go through the list of, but the key thing, what's really entered into the conversation, is the supposed association between measles, mumps, rubella, and autism. And that's a long discussion on its own. Just to come back to the final point, which is that association has been totally refuted because the science upon which one paper that was published was totally fraudulent. And I'd be happy to discuss it further, but we should quit talking about bad science and focus on the reality of what measles and mumps and rubella are really like and the damage that they can produce. I want to talk about one final vaccine-preventable disease, and that's whooping cough or pertussis. This is a bacterial disease in contrast to the viral diseases I've been talking about. So Bordetella pertussis causes this. It causes almost all cases. It begins with typical cold symptoms, runny nose, irritation of the eyes, followed by the beginning of a cough, which becomes very, very severe. Now, in fact, it's severe in older children, but young infants in the first several years of life may simply, because they can't produce a powerful cough, have episodes where they stop breathing for periods of time. And in other words, if you can't produce a powerful cough, what you see is the child struggling to breathe. And we had 10 deaths in 2013 in infants during a wave of pertussis that occurred that year. But pertussis is a bad disease for most people. The coughing, which generally lasts 2 to 6 weeks, may go on for several months. I pulled together 3 different clips.
Here we go.
Listen for the whooping sound. When the child cannot breathe and now takes a deep breath.
It's okay. Okay, take a breath in, honey. Come on. Almost there.
That is the hoop of whooping cough.
Here we go.
Not everyone hoops who has a whooping cough. And this will be followed by a clip of an adult. The thing to emphasize about this is there isn't anything to cough up. Especially physicians who take care of adults will often mistake this for bronchitis or concerns in smokers about lung cancer. But there's something about this bacterium that still isn't understood now, where Bordetella just produces an irritant to the lungs, so that in most people you're going to look at a normal chest x-ray, the doctor will put a stethoscope on the chest and the chest will sound completely clear, and then the person just has these coughing jags, which, as I said, last 2 to 6 weeks. People look at you incredulously when you're talking to them when they're in between their coughing, or when they're talking about their child, and they say, well, what can we do about the cough? And your honest answer is, not much. No cough suppressant medications are effective with this. This is a disease that has to run its course. The problem, of course, is that 2% of children will have seizures. Infants who haven't received a single dose may die from damage to lungs that's kind of specific to the way this infection works in infants. It is a terrible condition. It is not a make-believe condition. If you look at YouTube, you will find 10 clips like this within seconds of what the pertussis cough sounds like and looks like. Not everybody does the whoop, but the persistent hacking cough, not being able to bring anything up, with moments of, with periods of time in between where you feel absolutely fine, only to begin coughing again. That's what's characteristic of this disease. And cracked ribs, coughing jags in the middle of the night, the sensation of choking, these in adults, these are all well-known aspects of this condition. And in California, we continue to face this. I could have put in the national statistics, but I thought I should bring it home to what we actually continue to face. This is the most common vaccine preventable disease that we have in the United States, and we still face it in California with nearly 10,000 cases last year, several hundred hospitalizations, and 80 individuals requiring ICU care. Now, it's not, again, that the vaccine is 100% benign. Fever, soreness at the injection site, fussiness are quite common. More moderate effects, including vomiting or fatigue for a day or two, are seen in children fairly often after the first few doses. And there are reports of what would be considered moderate symptoms. And again, we could go through the whole litany of these. But this is an extremely common infection that is quite dangerous, and that's what we're trying to prevent by using vaccines. So again, we could go for quite some period of time looking about each disease, why the vaccine schedule that we have is intended to protect against them, how dangerous these are. We really don't have vaccines for trivial diseases. All of these are dangerous diseases. And I want to emphasize then, going back to that title about myth versus reality, that measles, polio, mumps, whooping cough, these are far from benign or mild diseases. These are terrible diseases that have plagued us for so long that the opportunity to try and prevent them has led to the development of safe vaccines. And the vaccines used in the United States have been improved and turned over in the last 30 or 40 years. We've gone from one preparation of polio vaccine and measles vaccine to another, trying to get the best balance we can out of protection and safety. The goal, of course, is to ultimately be able to eliminate some of these diseases, and if not, in the case of something like tetanus, to try and make the vaccines absolutely as safe as they are. But I think that the way we should be looking at this overall is that we have to have a reason to deny ourselves, our children, our family members of the protection that's afforded by the current immunization schedule that we use in the United States. Thank you for your time.